So welcome back to Better Health's live coverage here at HIMSS 10. Mike Sevilla here, and we're here with Lorraine Fernandez. Is that right? From Initiate Systems. Thank you so much for joining us here this morning.
Well, happy to be with you. Thank you.
So for people who are not that familiar with Initiate Systems, wow, I just the text really threw me off. Initiate Systems. What can you share with our audience about that?
Initiate Systems is a company that was founded in 1995, actually started out in healthcare, and one of our fundamental products addresses the matching and linking of patient or provider records, citizen records across the healthcare ecosystem, because it's so fundamental. Who is Lorraine Fernandez, despite the variation in my name, my age, women do get younger, you know, and address, phone number, things like that. That is a fundamental problem that healthcare has to solve in order to achieve meaningful use.
Okay. And I see you have your notes there. So you have some thoughts about EMR. Why don't you share those with us?
You know, there's clearly a big push on for adoption of EMRs. We've seen the draft that's gone out, if you want to call it a draft, the end of December about meaningful use, and certainly encouraging with the incentive monies, the adoption of EMRs out there. But that won't be enough. Clearly, we have to produce quality data. We have to be able to measure outcomes. We have to be able to improve population health. And I think that sounds like motherhood and apple pie, and in some ways maybe it is, but there's a lot of steps to that journey. So getting EMR adoption is important. Linking of the data in order to share that beyond the silo that it may be created in, and then e-prescribing. So those are the three basic tenets of meaningful use that we're all marching towards. And
Greg, and what kind of solutions do you offer for that?
so what the industry might know us as is an enterprise master person or master patient index. And that's, like I said, the matching and linking of records despite the variation in capture. And it's interesting, particularly in, I'd say, the last 60 to 90 days, the importance that the industry is now placing on a provider registry. It's not just who is the patient and where do they have records and how do we connect those records, but who is the provider, because they're known by many different things. Yes, there's an NPI out there, but there's a lot of variation in that also, and a lot of rigidity. So having provider registries on top of patient registries is something there's a lot of discussion at the NHIN work groups out there today, so that we can then match that patient record to where that care was delivered by which specific provider, and then be able to share that record, you know, in a connected, real-time fashion to truly deliver the better care that we want.
So can you share with us kind of a very specific example to try to help solidify what you do?
Okay. So I'll give you a couple of different examples, if you don't mind. A long-term customer is Sutter Health. Success stories out there about them. They have for years used this technology to allow better and more consistent patient identification at the point of registration. Keeps patients happy, saves them time, saves them money too, and then links those clinical records that are associated with the accurate identifier across a health system. They also use a provider registry to ensure that they can disseminate those electronic results of lab and radiology and discharge summaries out to the caregivers, push them back out to the physician offices in order to have that information available for care. The other example I would use is UMass, which is a newer client, again using the same technology of who is Lorraine Fernandez, how do we correctly identify her, and then using the Initiate Exchange product to be able to push those results in a much more structured, automated, real-time fashion out to the physicians who might be owned by UMass, but I think probably more importantly in healthcare today, those community physicians who are out in the small practices, the 2-man, the 5-man, the 10-man practices that we hear, you know, are the bulk. What's 75%, I think, of healthcare is delivered by physician practices less than 5 individuals. So we've got to make sure we empower them with information.
So your software solution would then kind of bridge the gap, or as far as interface with like hospital systems? Am I understanding that correctly?
Absolutely. So you've got an EMR and the various components of it at a hospital. You may or may not have an EMR at that physician practices. So it's going to bridge that gap or create that connectivity between where the data may reside, sharing it back and forth, obviously with appropriate consents, etc. But it's bridging that gap of sharing the information and putting it in the hands of the clinicians, yes.
Well, that could be a lot of interfaces between hospitals and offices. Does your company kind of initiate that, or do you let the EMR provider at the hospital or the office kind of initiate that? How does that work?
So we've got a team of integration specialists who for years have worked on this. And because integration is their expertise, what we will actually do is place an appliance, kind of like a cable box, if you want to use that analogy, out in the physician practices. We simply ship it to the physician practices. It's a plug and play, plug X into Y and you're off and running, because our technology runs in a cloud, so the physician practice really doesn't have to do anything but plug the appliance box in. And then through the cloud, we will take care of all the integration and connectivity out there to make it very easy on the physician practice. They're small, they want to deliver care, they don't have a lot of technical resources in many instances, so we can take care of all of that. We can extend, physician outreach programs to help those practices so that they can truly focus on what they want, to give better care.